season is my favorite season, especially when the season involves saving our pumpkins. So please look at all the pink, and then we're doing breast cancer awareness today. Today, I will be informing you all about the awareness of breast cancer and explaining the signs and symptoms and treatments of breast cancer. As we all know, October is the month of breast cancer awareness. So during this month, we make sure to be able to give awareness and make it known that breast cancer can be beat if we all put our own heads together and learn how to do certain things in order to prevent it. So today, my speech will be about saving our pumpkins. Breast cancer can easily be looked over, especially when women are not taught how to examine themselves. So today what we will be doing is doing a risk factor questionnaire, and I want you all to participate with me while I am giving these questions. So some of the questions that your doctor may ask you when screening for breast cancer can be, what is your biological sex? What is your ethnic origin? How tall are you? How much do you weigh? Have you reached postmenopausal stage? How many times per week do you aerobically exercise? And this means something that makes your heart rate increase. Do you drink any alcoholic beverages? Has anyone, male or female, in your immediate family, parents or siblings, ever had breast cancer? Has anyone, male or female, in your immediate family had any other type of cancer? How old were you when you first had your first menstrual period? When was the last time you had a doctor perform a clinical exam of your breast or have a mammogram to screen for breast cancer? Have you ever had a breast biopsy with atypical results? And last but not least, do you have a primary care physician? A primary care physician is where all the awareness starts. We have to know that we all have to have a primary care physician that knocks off care gaps. Care gaps as simple as flu vaccines, pneumonia vaccines, Tdap, breast exams, things that should be done yearly with your physical. So when you begin with your self-evaluation or self-examination that you should do every month, women should know how their breasts normally look. You will not be able to know if you have any significant changes if you do not regularly examine yourself in a mirror after showers especially. This is when your breasts are the most soft, and so at that time is when you should do your monthly exam, and it should always be the week after your menstrual cycle. The strongest risk factor for developing breast cancer is age. So the older that you get is the more risk you have for developing breast cancer. So after 40 years old is when you're supposed to get your breast exam at least every 3 years if you do not have any abnormalities. But if you do, you should definitely do it every year. Women who are physically inactive throughout life may have an increased risk of breast cancer also. Being active helps with everything. It helps with your heart rate, your breathing, not to have cancer. So daily activities is the best thing for anyone, not even just specifically for breast cancer. Studies indicate that there are more alcohol a woman drinks is the greater risk of breast cancer. Alcohol should not be a factor for anybody's life. It should be something that is completely avoided, but especially in women because it can make the risk higher for you with breast cancer. 1 in 8 women will be diagnosed with breast cancer. So imagine sitting in your office and it's 8 different coworkers. 1 of you will have breast cancer. That's how wide the spread is, and that's why today I'm giving awareness on how the early detection of receiving breast cancer. The early detection means the easiest and most quickest recovery. So self-examination for breast. So like I said, you do it once a month, and you do it after your period, the week after your period, but also freshly out the shower. That is when your breasts are the most soft. and where you'll be able to palpitate any lumps or anything that's abnormal for you. After that, you should always look into the mirror. You should never just examine yourself. You should be looking, because you can see things that are different on each breast by looking at it while you're doing the examination. Touch all portions of your breast up and down and left and right. You start feeling for lumps and masses. And a lot of women don't understand or know that you're supposed to check under your arm too. Under your arm is where your lymph nodes at, and that's where they usually start at. So even if it's not your breast and if it's more over to under your arm, that's also an indication of breast cancer. And like I said, conduct the self-examination standing or lying down, but just make sure it's once a month, and also that it is after you get in the shower. So some things that you look for is look at the breast change in size. You check the breast skin for sores and color. You can squeeze each nipple between the thumb and finger to check for discharge. You can lie down on a flat surface each time to feel your breast. You do not have to rush with this. Please take your time and examine monthly for any type of differences in your breast. And once again, like I said, please feel your breast sitting or standing in the shower also. Alrighty. So, signs and symptoms of breast cancer. On April the 19th, 2023, symptoms of breast cancer stated that the signs and symptoms of breast cancer as is: pain in your breast, swelling, lumps, change in size, warm or hot feeling, dry flaky scaling, color change, rashes, sores, anything that has a color texture. Also, inverted nipples, discharge other than milk, soreness, itchy, crusty. And then once again, like I said before, please always make sure that you look under the armpit and also see if there are any swollen lymph nodes under your armpit also. Alright. So there's certain actions you need to take once you do spot cancer. You know your body better than anybody. So you will be the first person, you'll be your first advocate to realize that something is wrong with your breast. Once you're confident about knowing your normal self-examination, you are able to do it calendarly each day of the month. You should detect, see, or find or anything to change as a red flag, and you should immediately seek medical profession. Keep your medical appointments and keep your scheduled screenings. The first step is just to get screened. So that can knock out any problems if women just make sure that they go and get their yearly pap smears and get their breasts examined. Every woman fights the battle differently. Some have to actually have their breasts removed, but at the end of the day, I just want everyone to know that we're all beautiful and that we all fight with each other during this battle. Alrighty, so once we recognize the signs and symptoms, then we work on the recovery and the treatment. On December the 14th, 2022, the Mayo Clinic stated that the signs and treatments of breast cancer is many different options. The first one is just surgery. A lot of women love when you can just be able to go in and remove that lymph node that is infected, and a lot of women never get cancer again. That is usually the simplest treatment for breast cancer, but sometimes it is more difficult and more emotional with different type of scenarios. Breast reconstruction. From the beginning, all patients are given to me to a plastic surgeon when they have breast cancer. Because if they do have to remove, women like to feel like women. So women do not want to have a bare chest. So they're always given an option for reconstruction and to be able to look and feel as normal as they can. Chemotherapy. Chemotherapy drugs can control or stop the growth of cancer cells in your breast and kill any cancer cells that may have spread beyond your breast. These drugs may be used before surgery. They will shrink the tumor so when the surgery is not as invasive, or it can be used after surgery to reduce the risk of the cancer. Say, instance, if the doctor does not be able to remove all the cancer, he'll remove what he's able to, and then the patient will go on chemotherapy to be able to remove the rest of the cancer out of their body. Next is immunotherapy and targeted therapy. Also known as immunotherapy or biological therapy, targeted therapy is transforming breast cancer treatment by offering more powerful, less toxic approaches to eradicating the disease. Targeted therapy starts by identifying a breast cancer characteristic, then using drugs or other substances to trigger the body's immune to respond to interfere with any cancer cells operating. Next is also hormone therapy. Hormone therapy, about 2 out of every 3 breast cancers are on hormone receptor positive. And so this is simple as estrogen for women that do not have a menstrual cycle no more. And the hormone therapy lowers the hormone levels or stops them from acting on a breast cancer cell. Also called endocrine therapy, this approach is often used with other treatments. We also are investigating new drugs in clinical trials to overcome the resistance in certain breast cancers. Radiation therapy. Radiation therapy plays a vital role in preventing breast cancer. A lot of women have to go through radiation and also chemo. After breast conserving lymphodectomy to reduce the chance of cancer, it will return our breast or to the lymph nodes. So following that, they will have a mastectomy, which removes the entire breast and the tumor, and so the cancer will not spread. When the cancer has spread to other parts of the body, they then offer radiation therapy. You'll expect, and others may be hard to find somewhere else. If radiation is part of your treatment plan, the type of radiation your radiation oncologist recommends will take into account of your tumor size, the location, and other factors that may be included. So please remember in the month of October that in October we save our pumpkins. And that's meaning please be aware of all breast cancer awareness, and also please do your examinations monthly. Thank you.